Thank you for your question about this important impact that COVID has had in Europe and also for neurologists. Well, there are several points that we need to consider. One point is the real impact of the infection on what are the neurological symptoms related to the virus. So we had some news from China. According to some neurologists in China, the virus had 30% of complication between patients with the COVID. So we have been a bit scared. So we started, I think, in all the countries, they started a sort of registry, a sort of network to collect information about exactly what is going on for neurologists. And I think we had a more reliable picture because really we've been quite involved. And so there have been some registry indeed that have started the scene. I give you an example. There is a registry from France with around 200 and more cases about the COVID. COVID in France, there have been 1,000 and 1,000. So it looks that the percentage that has been reported before is a little less, which is a good news. And the most frequent neurological manifestation have been stroke, encephalopathies, all this impaired consciousness, and also above all in mild COVID, the anosmia, so the alteration of sense of smell and the taste, which is more a neurological symptoms rather than ENT symptom. The other thing is the impact on patients with already neurological comorbidities. So do patients with dementia, with Parkinson's disease, with multiple sclerosis have a higher risk of having this neurological complication related to COVID or just to get COVID? So there are questions that that we are trying to answer during this time. So this is a difficult question because you have to think that during this pandemic, basically everybody was concentrated on trying to intubate this patient, to ventilate these patients, to isolate patients with COVID from the other, patients that they had to come to the hospital because they were sick for other reasons. And so in this sort of, I would say, chaotic, difficult situation, patients with other comorbidities, they were a bit neglected, if you want, because everybody was trying to save their life first. But then other countries that had been prepared more to take over this wave, taking advantage of the experience of the other, they started, as I said before, to ask questions about a patient with Parkinson's disease, right? Can have more be impacted a little more by the COVID because he moves less, because patients with Parkinson's disease, sometimes they have difficulty in breathing, they can have a difficulty in swallowing, so they are higher risk. So briefly, because neurological comorbidities, there are quite a lot, it doesn't seem overall that patients with multiple sclerosis, as I said, with epilepsy, with dementia, Parkinson's disease, they've been hidden more compared to other people. Indeed, we know that most of the patients who had severe COVID, they had diabetes, hypertension, and also that we have to say maybe some cerebrovascular disorder in the past. I think the most difficult decision were for the neurologists dealing with patients with multiple sclerosis, because there was the idea that because they're already immunodepressed, because they're taking a lot of immunosuppressant treatment, they were more at risk of having the virus. But actually, there is a nice paper from Italy with a sort of registry studying patients with multiple sclerosis who got MS. And actually, it doesn't seem that in these patients, the disease was more severe. Actually, 80%, like all the others, they had a mild form of COVID. There were some patients who had the severe, and actually they died. But these patients who died, they had severe comorbidities, diabetes, hypertension, the same one that for the other population, general population who had COVID. So, generally speaking, that I think we are not really particularly concerned about spatial management in patients with the neurological comorbidities.